Good afternoon, everyone. We're going to give it a minute or two before we begin so that we can allow folks to enter the webinar. Thank you for joining us for day 2 of the second annual Shifting Paradigms Conference from PSRPA. I'm excited to bring this panel discussion to you. Before I hand it over to Laura to kick us off, I just want to give a few housekeeping notes. Feel free to use the chat for any resources, insights, comments that you'd like to share. If you could use the Q&A option at the bottom of the screen for your questions, that would be best so we can keep track of them. We can't always keep up with the chat. And if you have any questions following this conversation, feel free to email us at info@psrpa.org, and we'll get back to you with an answer or any resources that you requested. With that, I'm going to hand it over to Laura.
Thank you. And thank you for joining us for Cancer Corridors, Lessons Learned in Environmental Justice Communities. My name is Laura Dagley. I'm a nurse and the medical and environmental health writer for PSRPA. I'm also part of a coalition here in Southwest PA that was concerned about an increase in rare childhood cancers and other health impacts in a heavily fracked region. And we were able to get the Department of Health to commission several studies that explore the relationship between natural gas and health. The results of which were published this past August, and they showed health impacts, although we are still waiting for an official state response to the studies. The experience of health impacts from industrial pollution, communities that are fighting for government intervention and acknowledgement of the science is a shared issue in environmental justice communities. And that's what we will be talking about today. So we have with us Dr. Kimberly Terrell, who is a research scientist and the Director of Community Engagement at Tulane Environmental Law Clinic in New Orleans. And she's going to be presenting along with Gianna St. Julian, who is a researcher and community engagement specialist at Tulane Environmental Law Clinic. They are going to be discussing some of their work around communities impacted by industrial pollution in Louisiana and help us learn how to look at the existing research around health impacts. We then will have Roishetta Ozane, who is the founder of the Vessel Project of Louisiana and an award-winning environmental justice advocate, tell us about her experience living near industrial pollution. And finally, we have Jody Borello, who is a community organizer for the Center for Coldfield Justice. She is part of that coalition that I mentioned earlier, co-founder of MadFacts and an impacted resident. Tell us her story. So again, if you have any questions during the presentation, please place them in the chat and we will get to them at the end. And I will hand it over to, I believe Gianna is going to start.
Yes, thank you, Laura, for that introduction. Kim, if you want to go ahead and share the slides. Okay. So hi, everyone. My name is Gianna St. Julian, and I'm here with my colleague, Dr. Kim Terrell. And we are going to be discussing some information regarding lessons that we've learned from dealing with environmental justice issues in Cancer Alley in Louisiana, and touching on some specifics about data misuse, research gaps, and the burden of proof that's often placed on communities. So I'm going to start off discussing our study that's focused on pollution and cancer in Louisiana, and then Kim is going to talk more about how some of our lessons learned in Louisiana can apply to the recent studies that Pennsylvania conducted on the childhood cancer. As far as the misuse of science against communities, a few of these ways are things that we've encountered along the way. For example, no research is often taken as no evidence of a problem, which is not usually the case. Sometimes there is just, if there's no research, then there's no way that you can find the evidence that supports the issue. In other cases, flawed studies and reports and analysis can sometimes contribute to this misuse, including studies that have exposure misclassification, studies that fail to account for confounders and interactions between different variables, and also being statistically underpowered by having such small sample sizes. And lastly, misuse of legitimate studies or data sets, which is something we see pretty often in Louisiana. And I'll dive deeper into a few of those next. So, like I said, data gaps can benefit polluters. And it's important to note that all of the pollution data that I'm going to be talking about are ultimately based off of self-reported emissions from industry. And when it comes to air monitoring, the vast majority of fence line communities in Louisiana don't have air monitors. And the few that do, the monitors only measure, a handful of pollutants at most. And in this way, this burden of proof always seems to be on the communities that are being affected. We often hear that there's no evidence of these cancer and emission burdens, but if there's no research, then there will be no evidence. So in this way, this is how that data gap always benefits the polluters. So here, where do we currently stand on EJ issues in Louisiana? Well, there's a huge disconnect. This quote here is actually from a permit decision for a company, Formosa Plastics, that was looking to build an enormous plastics facility in St. James Parish, Louisiana, particularly in a census tract that was already overburdened with pollution from industry. So this quote from LDEQ says that the LTR data, which is Louisiana Tumor Registry, suggests that local cancer rates in St. James tract are not elevated compared to the Louisiana state average. But if we go ahead and look at this graph over here, you can see that the cancer incidence values, you can clearly see that that local rate is higher than both the state and the US average. And even if you look at those error bars, this is telling you that 95% confidence interval. So we know that the true value for the cancer incidence is somewhere in that range. And it could be lower, it could be higher. But in this case, you can see that, the local rate is higher than both of those. But what the LDEQ means when they say that that local rate, is not elevated, is that it's not statistically different from the state average, meaning that it doesn't pass that threshold of statistical significance. But not being statistically significant doesn't mean that there isn't a problem. So now, you look at the cancer incidence values from the most recent Louisiana Tumor Registry report, and you can see that that local rate has increased even more. And now it passes that threshold of statistical significance. And even looking at that error bar again, we can see that regardless of where that true value lies in that confidence interval, it's still higher than both the Louisiana and US averages. So this example, touches on that misuse and misinterpretation of cancer data, and how, unfortunately, this misuse is being used against those overburdened communities. So here we actually have a map of St. James Parish, which is the area I was just referring to. And this is in the industrial corridor where, a lot of these questions and concerns about pollution-related health outcomes have received a lot of attention recently. And the data here is from the national percentiles of the 2017 Air Toxics Cancer Risk EJ Index, which is a value that factors in pollution, race, and poverty, so accounting for demographic vulnerability. So previous approaches in research would often group areas like this into one single cancer incidence value. But this figure clearly shows that there's a lot of variation in cancer risk from toxic air pollution that occurs when you're dealing with such demographically and industrially different areas within a singular parish. So it's important in research that, we have a data set that more accurately reflects that local variation that we can see here when you're dealing with neighborhoods in a single parish, and allows for that even greater statistical power by having a larger sample size for those studies. So something that, really helped us out with that data gap was that in 2018, the Louisiana Tumor Registry actually started to release that census tract or neighborhood level cancer data. So with this new approach, we now have a sample size of about 1,000 for the state of Louisiana, which equals, one per census tract, one per neighborhood, versus the previous approach, like I said, which would only provide a sample size of about 64 for the entire state, which is one per parish. So this definitely makes it a lot easier to distinguish between cancer rates for census tracts that are within the same parish, but are, not within the same proximity to industrial facilities within that parish, like the previous slide I just showed of St. James Parish. So with all of that being said, when Kim and I approached our study, there were two main questions that we were looking to answer. So one, are the firsthand experiences of Cancer Alley residents reflected in the tumor registry data? And two, does toxic air pollution contribute to Louisiana's high cancer burden? So here we have a table showing some of the important cancer incidence data from our study. And when we look at the cancer rates for each of these data subsets, you can see that the impoverished areas with very high pollution and impoverished areas with very low pollution have higher cancer rates than their affluent counterparts. And when you break that down even further, you can see that those impoverished areas with very high pollution have higher rates than the impoverished areas with very low pollution, meaning that pollution is a significant driver of cancer rates in the state. And, you might ask, well, why don't we see this link in predominantly white or affluent neighborhoods that also have high pollution? And the fact that we didn't see this relationship between pollution and average neighborhood cancer rates in affluent neighborhoods could either mean that the neighborhoods aren't as susceptible to cancer or that there's something that's masking the effect. So some possible reasons for this are that exposures differ in neighborhoods with older homes, as there are more cracks that allow the more polluted air to make its way into a person's home. There's also a lack of high quality preventative medicine in Black neighborhoods, which often leads to, higher rates of misdiagnosis and less early intervention with the treatment of diseases associated with pollution exposure. And also, a lot of geographic mobility comes into play in white or affluent neighborhoods, meaning, they're more likely to move around from one area to the next instead of remaining in those polluted areas. And also, neighborhood growth rates are higher from people moving into those affluent neighborhoods. And those people are coming with, different levels of exposure from their previous residences. So once again, these are all possible explanations for the data not showing this link, but ultimately, more research must be done in the area to get a more concrete answer. But because this link is so present in the impoverished areas, we must consider this we must consider these findings in environmental decision making. So as far as some take-home messages from this study, cancer studies must account for latency, exposure variation, co-founders, and potential interactions between variables. The lack of research or lack of significance is not conclusive. The nature of statistics makes it difficult to link pollution with health problems when you're looking at small populations. So that's where, looking at studies of larger sample size really comes into play. Also, we must shift the burden of proof onto the polluter as opposed to, putting that burden on the communities that are already being impacted by the pollution. And, we must focus on risk and existing research. When we're in a situation where you have an absence of information, if we don't know what people are being exposed to, it's not their burden to figure out. In situations where you don't have a lot of specific information, we should really allow on the information we do have. We should look at the studies that acknowledge all of these harmful pollutants and the effects that they have on the people who are being exposed. So with that being said, I'm actually going to pass it over to Kim now, and she's going to talk more about those Pennsylvania studies.
Thanks, Gianna. So I'm really happy to be here and have the opportunity to talk about these findings with you all. I have to say, studies like this probably wouldn't happen in Louisiana. So I want to dig into it, but I also want to kind of start by saying that these were pretty in-depth studies. Statistically, they were pretty well designed. And so I think all of the people who have advocated for this research should take a moment and reflect on that accomplishment, because it's a pretty big one. So I'm going to focus mostly on the childhood cancer study, because the other two studies were more straightforward and the results were more straightforward. I'm going to focus more on the non-significant findings and the reasons why this study might not have detected a link between rare childhood cancers and fracking activity. So the study, as many of you probably are aware, was designed as what's called a case control study. Case control studies are well suited for rare diseases like childhood cancer, because whenever you have a disease that's rare, you want to start with the population that has that disease, right? So rather than saying, hey, we're just going to pick some neighborhoods and look at the overall population, if it's a rare disease, you would end up with a small number of cases. So by starting with the cases, you can ensure that you have enough of them in your study to where you can hopefully detect an effect if it exists. And so the important, the main consideration here is that the cases in the study should be representative of all people who have the disease, right? So if you were only collecting data from one hospital that serviced a particular population, that might not be representative. In the case of this study, it seems like it's representative, though I'm certainly curious to hear, thoughts from community members. And then finally, I want to point out that this type of study design does not work well for rare exposures. So from looking at the study, it seems like it's relatively common for people to live within 5 miles of a fracking site in that 8-county area. But I want to point out that not all fracking sites are created equal, right? So as you all know, fracking involves pumping a whole bunch of water into the ground, or I should say a whole bunch of fracking fluid into the ground. The composition of that fluid can vary, and it also can vary when it comes back up, right? So we know that there can be radioactive materials underground that fluid picks up and brings back to the surface or to aquifers. And so there's going to be variation in that, right? Not every community is going to be equally exposed. So that's just something important to keep in mind. So looking at the summary, one of findings, one thing really struck me, right? Like the study was pretty well designed from a statistical perspective, in my opinion. But there seemed to be kind of a disconnect between the statistics and the findings and the messaging. And I'm sure this is not a surprise to most people in this group. But what really struck me was that the one pager started off by talking about the non-significant findings, right? So as you all know, they looked at rare childhood cancers overall, and then they looked at specific types of childhood cancers. And so for 3 of those types, leukemia, brain, and bone cancers, there were no significant associations. And so to really dig into this, we need to talk about something that's kind of boring called statistical power. So when we say power, what we mean is the likelihood that a study would actually detect an effect if it were present. So in this case, the statistical power of the studies is the likelihood that they will detect the health effect associated with fracking, if that link really exists. And so there's 3 kind of big things that affect statistical power in a study, right? The sample size, how consistent the data are, and the size of the effect, right? So if you have a study with lots of people and there's not too much noise in the data, and there's a really large effect of the exposure, you're more likely to be able to detect that effect. And so in general, the convention is that, studies should have a power of at least 80%, meaning that there's at least an 80% chance that the study would detect the effect if it exists. And you can think of it kind of like if you put on a pair of sunglasses and you're trying to look for a sign, and 80% of the sunglasses are clear and don't have, dirt on them. There's a pretty good chance you'll see the sign, right? But if only 10% of that area is clean, it's going to be a lot harder to see and detect that sign, even if it's present. So it's kind of a simplified analogy, but that's how I like to think of it. So in the big report for the childhood cancer study, there were a lot of tables presenting statistical power values. And that's what I started at. That's what I really honed in on. So I want to just take y'all through one of these tables quickly. So the odds ratio is the effect size, right? So an odds ratio of 2 means that fracking causes twice the risk of this cancer. And so the other factor that's important is how common the exposure, fracking, is in the control group. So if 5% of the controls are exposed to fracking, that's going to give you a different level of statistical power than if a higher proportion of them are exposed. So as an example here, if we just look at the 2.0 column, it tells us that we would have a 79% chance of detecting that effect if it really exists. And that chance goes up to 100 as the proportion of controls exposed increases. And so in the study, they found that about 20% of the controls lived within 5 miles of fracking, but only 2% lived within 1 mile. So I really want to emphasize that point, right? Like if living within 1 mile is really what's driving these health outcomes, that's a much rarer exposure than the 5 mile group. And that's going to affect the statistical power, right? For the individual types of cancer, those power values are even lower, right? And so this is why it's not really surprising that they didn't find links for many of the individual cancer types. So this table shows the same kind of information. And if we look at the 20% controls exposed row, we can see that there would only be like a 76% chance that the study would have detected an effect that made it twice as likely that people exposed to fracking would develop childhood leukemia. So what I really want to emphasize here is that just because there's a study done and just because a link exists doesn't mean that that link is going to be detected by the study. What was not included in the study was this power table for Ewing sarcoma, right? Which they abbreviated EWOT. So I calculated these values myself using the online calculator that they provided. And so even in the absolute best case scenario in this table, if you look at the very last row and the last column, there's only a 24% chance that the study would have found a link between Ewing sarcoma and fracking. They had only 20 cases, and it's virtually impossible to find a statistical relationship with a sample size that small. And so if we calculate this another way, using that same online calculator, we can say, if 20% of people in the control group were exposed to fracking operations, an increased risk of Ewing sarcoma up to 7 times would have remained undetected. And similarly, if it's that 1 mile radius that's most important, people living within 1 mile, they could have still had a 30 times higher risk of Ewing sarcoma that would have likely remained undetected by the study. And if we look at the data tables, what stands out to me is these confidence intervals in the last column. So this highlighted cell indicates that people who lived within 2 miles had a higher, had an elevated risk of of Ewing sarcoma compared to the control group, right? So 1.72 times higher. But you see that confidence interval is really wide. And so that's why the result was non-significant. And in fact, the ratio of people who developed Ewing sarcoma in that exposed area, more than twice as many people who had Ewing sarcoma were exposed versus unexposed. And that's a bigger proportion than among the controls. So to say it another way, there were a disproportionate number of cases of Ewing sarcoma among people who lived close to fracking sites, but it did not meet that threshold of statistical significance. So if it were me and I were presenting the results of this in a one-page infographic, I would have added some caveats, right? I would have said, hey, sure, there were no associations, but our tiny sample size may have prevented us from detecting much higher risks of Ewing sarcoma associated with fracking. And if you dig into the study, they do acknowledge that these comparisons were underpowered, and they mean statistically underpowered. I would also have pointed out that these individual cancer types contributed to the overall association, right? And that's why looking at that overall association for all cancer types is really important. And if you look at the strength and limitations sections of these studies, there's really useful language. So this is word for word from the section of that study focused on the strengths. And after reading this, I was really surprised to look again at that one-page summary because it seemed like the results had really been watered down. And I really, you know, if it were me, would have emphasized the limitations of the small sample sizes for those other rare cancers. And again, this is straight out of the limitations section of the study. So to wrap up, I would definitely recommend looking at those strengths and limitations sections for each of these studies. If you guys haven't already, maybe think about creating your own one-page summary and infographic. I would present these as really well-designed, strong studies because they are, but there is always going to be a challenge in studying extremely rare health outcomes, including Ewing sarcoma and other types of very rare cancers. And you may also, if you haven't already, reach out to the authors of the study and get their feedback on any summary or any materials that you might design. So I know I'm a little over time. Thank you all for listening, and I'm happy to pass it back to Laura.
Thank you. That was all super interesting and helpful. And I think there's a lot I want to talk about there. But first, we're going to hear from Roishetta and Jody. And we'll start with Roishetta. Why don't you tell us some about your story?
Hi, everybody. First, I want to apologize for not being on camera. We are under a flood warning here, so the weather is really bad and the internet is acting up. I also want to apologize for the way that I sound. I'm battling with the head cold, but I am Roishetta Ozan. I am the founder, director, and CEO of the Vessel Project of Louisiana. The Vessel Project is a small mutual aid organization located in Southwest Louisiana. We assist people in the state of Louisiana, the state of Texas, and the state of Mississippi, because we found out that during Hurricanes Laura, Hurricane Delta, Winter Storm Uri, and the flood that happened in May of 2021, many of our citizens from Southwest Louisiana relocated to areas that border the state looking for resources. And so we still assist those residents who no longer are here, but some are trying to come home and others are misplaced indefinitely. So I just really want to speak today from a perspective of a community member. I'm also a mom of 6. Our air here smells like rotten eggs. Here on our coast, we lose a football field of wetlands every hour. Our groundwater levels are receding faster than any other state in the nation, and we are running out of drinking water. We have above average poverty rates, above average cancer rates, and above average toxins in the air compared to even the rest of Louisiana. Now, many people talk about Cancer Alley, which is a several mile stretch between Baton Rouge and New Orleans. I live in Southwest Louisiana, in the area surrounding Lake Charles, in a town called Sulphur. In the area of Southwest Louisiana, we have more than a dozen petrochemical and plastic burning facilities, but also we have 3 of the current 5 LNG facilities in the nation. And those 3 facilities are situated at the mouth of the Calcasieu River. Right now, there are more than a dozen more of those facilities proposed to come along the Louisiana Gulf Coast, with 4 of those facilities currently having permit applications at the Department of Energy. So I wanted to give all of that context because also here in Southwest Louisiana, we are slated to receive the first ever direct air capture hub in the United States, and hydrogen hubs, and also carbon capture and storage. So with all of that industry that is polluting our air and our water, our children, our elders, and other community members, we have a very low chance of escaping cancer diagnosis, asthma diagnosis, other respiratory issues. I myself, with 6 children, 2 of my children have asthma. Some of my children have breathing issues. I have a daughter who has a rare skin condition. And all of this is coupled with the fact that every day when I'm driving them back and forth to school, I'm passing by industry. So not only are they inhaling and breathing this in at home because it's in our backyard, but they're also breathing it in at school. When are these children supposed to get any relief? Recently, my 17-year-old son was diagnosed with epilepsy. He had never had a seizure in his life. Very active kid, played football since he was 4 years old, did rodeo, was learning to weld, and all of a sudden had a seizure last year in May. Where he was when he had that seizure, he was driving home from Westlake, Louisiana, to where we live in Sulphur, which is only about a 4-mile distance. But driving home, again, remember, he has to pass all of those industries. Well, while he was driving, he had the seizure and he crashed and totaled the car. Where he crashed was in between 2 of the most polluting industries we have here in Southwest Louisiana, Phillips 66 and Sasol. There was a flare going from Sasol at the time. Now, the local doctors won't say that the industry is what caused him to have the seizure. They won't even talk about the fact that long-term exposure to industrial pollution can cause seizures. They've said that it could be an anomaly. It's sometimes people have a seizure in their life and they never have them again. Well, my son has had about 10 seizures since he had that seizure in May. What's changed in our life is that we lived in Westlake, Louisiana for about, 11 years. And then we moved to Sulphur after losing our home in Westlake to the hurricanes. When we moved to Sulphur, we moved closer to industry because that's where the affordable homes were. Now, I'm not a scientist, I'm not a doctor, and I can't say for certain that cause is what changed my son's health conditions. But I know when we made that move and we were forced to live in a FEMA trailer here in Sulphur, that's when his seizures occurred. That's when my daughter developed the rare skin condition. That's when my 5-year-old was diagnosed with asthma. So again, I come from a personal perspective, representing the numbers that you're seeing on the charts. It is hard to find this type of data in Louisiana, as stated before, because doctors and other experts, I hesitate when I say experts, will say that these could be other life choices that are contributing to these type of illnesses in people who live here. But we know what's changed in the last several years, as these numbers have gone up, is the amount of fossil fuel polluting industries that we have along the Gulf Coast. In connection with that, the amount of climate-induced disasters has also gone up. So we look at those two things, and we look at the fact that one of the life choices that they like to blame things like cancer and respiratory issues on is cigarette and tobacco use. Well, the cigarette and tobacco use has gone down in the state of Louisiana. In fact, smoking is banned in several places in Louisiana, but yet cancer rates are constantly going up. Asthma rates in children are going up. Respiratory issues are going up. Again, I'm not an expert. I'm coming to you all as a mom just to make this the data that Dr. and others have presented so eloquently. I just want to make it more realistic for you. I believe that the unarmed truth and unconditional love will have the final word in reality. This is why right temporarily defeated is stronger than evil triumphant. That is a quote from Dr. Martin Luther King. We have been fighting these injustices for so very long, but it wasn't until the last several years that we really started looking at how environmental injustices, how they cross over into the other injustices that are faced by Black, brown, and indigenous people of color. It is a known fact that Black people are at the top of the list for everything bad, and so is the state of Louisiana. With a state like Louisiana being filled with billion-dollar industry, we should at minimum be at the top of lists that are our rights to live. We are at the bottom of Maslow's hierarchy of needs. We don't have clean air. We don't have clean water. And if you don't have those basic needs met, how can you grow? How can you move forward? And that is where the Vessel Project comes in. The Vessel Project's mission is to make sure that people are okay, that their basic needs are met, that if you are worried about how you're going to pay your bills, what you're going to feed your kids, if you need safe water to drink, we provide those things with no questions asked so that you can be in a better position to see what is happening around you and what is causing you to constantly be in that position. In the last several years, the United States has become the largest exporter of methane gas in the world. Methane gas, like all fossil fuel pollution, has significant health impacts on Black, Indigenous, and people of color communities. Exposure to methane alone causes an estimated 1 million premature deaths every year. 1 million. More broadly, studies confirm that due to systemic racism, our communities are more likely to live in areas of higher air pollution than non-Black communities. Long-term exposure, as I stated earlier, long-term exposure to these pollutants can lead to a variety of adverse health impacts, including all of those things that I listed. So why isn't this data accessible to local residents who are living in communities that are overpolluted? It is because we have been deemed a sacrifice zone. They do not care about us. They don't want us to know the truth. And this is where it ends. I would like to end with a request and a plea for you all to join us in DC on February the 6th through the 8th. We will be doing a sit-in at the Department of Energy, urging the Biden administration to halt all permits of new fossil fuel extractive industry as they take a deeper look into the public interest determination. That deeper look should include frontline community members. We should be helping to shape that framework of what is in the best interest of the public, because for so long it has not been in our best interest for these industries to be our next door neighbors. Thank you all so much for allowing me this time. Again, I apologize. I am very sick, but I just tried to muster through and I'm not on camera because the internet is going out. I hope that you all were able to capture my audio, and my 5-year-old in the background was whistling. So I hope you all enjoyed that. He's saying sorry in the background. Again, thank you all, and there's simply more to relate. They can share my contact information with anyone who is interested in reaching out. The only way that we win is with people power. We have to stop doing site fights. This is not about fighting particular industry. This is about highlighting how all of us are connected, how all of us are impacted, and what can happen to stop this madness. Thank you all. Have a great rest of your day.
Rashida, thank you so much. Yeah, we didn't need you on video to get the, you know, how powerful your message is across. So thank you for showing up even when you didn't feel well, because I think your story is really important. But and we are, again, we're going to get to some of the questions after, but we're going to move to Jody's presentation, and I am going to share my screen. Okay.
Thank you, Laura. So my name is Jody Borello. I am the Washington County Community Organizer at the Center for Coalfield Justice. We are an environmental justice advocacy group based out of Washington and Greene counties in southwestern Pennsylvania. So I'll give you a little bit of backgrounds of my story, and I think my story is a good representation of what is happening in both Washington and Greene counties. You can see on this map, if you see where the Park Avenue Baptist Church is, I live on the adjacent hillside to the right, and you can see that we are surrounded by well pads. So those are well pads that are on the western side of our roads. In the north center, you can see it's a tiny little dot. It looks very insignificant, and I will get more into that, but that is the location of what is called a pigging station. And go ahead, Laura, if you could change for me, please. Thank you. So if you're not familiar with what a pigging station is, this is the way that the companies can clean out everything that they do not want in their lines. So anything that will clog up those gas lines, they need to clean out. And what they do is they insert what's called a pig at the well site, and they will turn the gas on, and it'll shoot it to this above ground pipe system here called a pig receiver. And you have to release the gas in order to take the pig out safely. And this particular site at the time did not have a name, but it is now named the CNX Oak Springs Pig Station. And CNX blew off from this pig station 7 days a week, 3 times a day for over a decade, rendering my yards completely useless. If we were outside, we would have 60 seconds before those contaminants would blow into our yard. And if Laura, if you could play that video, please. So I don't think the sound is working, but you can see how it's blowing across the hill and into my yard. I live approximately 1,400 feet from that site on the adjacent hill. And you can see how quickly that blows into not only my yard, but into my neighbors. If you could switch, Laura, if you could turn the page, please. So this is my beautiful son, my third child, Nico. And when this substance would blow into our yards, it would give us rashes. They were painful rashes. I had chemical burns to my eyes. This went on and on and on. And finally, we came to the realization that we cannot be outside and if we are caught outside when CNX was blowing off, we had to immediately run indoors, whether that was to the front of the house to get into the garage or just in the back door. And Laura, if you could turn page, please. These are again our pictures of my son, Nico. We had taken him to Children's Hospital and basically we were told there was nothing we could do to get an attorney or to move. This is a picture of the first time that I received this rash. You could see it was all over my chest. It was on the side of my face, anywhere that I had skin exposed, which include my wrist, my hands, and my feet. So I had contacted the DEP for a very, very long time and was getting no results. They didn't even know what this above ground pipe system was behind my home. I wasn't getting any answers. I couldn't get them to stop. And I had contacted the Attorney General's office, and it, not only my story, but others ended up turning into this grand jury investigation. And in this grand jury report, there were 8 recommendations. The one that I am going to talk about most was expanding the no drill zones in Pennsylvania from the required 500 feet to 2,500 feet. CNX ended up receiving criminal charges for what they did behind my home. And I'll get into how that happened. Every time they would pig, I would take a photo and I would document in a notebook. And my results were not corresponding with what CNX said that they were doing. And they ended up receiving 4 counts of Air Pollution Control Act. So, this is dear to my heart. I know what it did to my family. I know what trouble it put upon my community. And I ended up taking a job with the Center for Coalfield Justice. And I met a wonderful community member named Janice Blahnock. Her son had passed away from Ewing sarcoma several years ago. And she and I decided we wanted to start a volunteer group within CCJ, and it's called MADFACS. That's Moms and Dads Family Awareness of Cancer Threat Spike. And we were seeing more and more families that were coming to us and saying, my child has cancer. We've noticed our neighbors have cancer, brain tumors, Ewing sarcoma, things that we just, we're seeing a rise in, but we're not getting any answers from the state or our government of why this is happening. So we created this group to bring people in together and see what we can get accomplished and get the word out there and welcome families into our group. So this past summer, as we had talked about earlier, the Department of Health did do a study. We waited a very long time to get those results back. We had gone over that, so I won't go over too much, but what we do know that children living close to wells were at a 5 to 7 times greater risk of developing lymphoma. So this study did not take into account pigging stations, which are a major, major source of methane pollution. Even after the criminal charges with CNX, we're still having issues in our neighborhood with this pig station. Last December, they blew off over 500,000 SCF of methane within 29 minutes. I, however, witnessed this event, and it went on well beyond the 29 minutes that CNX is saying that it occurred. So there was a possibility that it let off over 1 million SCF of methane within 1 hour in a community. So even after this health study, we were very hopeful. We thought it was going to bring change. We were hoping the governor, who at the time was the Attorney General in Pennsylvania, who conducted this grand jury report. So he's very well aware of the community members that were affected by this. He's very well aware of what's happening in Washington and Greene counties. And instead of taking the information from this study and helping people and helping our community, what he decided to do was enter into a mutual interest collaboration with this criminal company, CNX Resources. And within this mutual interest agreement, CNX expresses its intention to voluntarily refrain from drilling any new unconventional gas wells within 600 feet. And that is measured horizontally from the vertical wellbore from an existing building. So what that means is the wellbore is in the center. So you start counting feet from that spot. So a home can be closer to that well pad that could be letting off contaminants, other equipment on site. This was hard to swallow. This agreement, it was very disappointing, especially for me. I know it's disappointing for my community, and we're not really quite sure why the governor did this. In his grand jury report, what the grand jury, the jury of our peers, decided on was 2,500 feet. And he is partnering with the company, an industry that is a known polluter. They are a criminal company, and that is who he is siding with. He decided not to stand by the people of Western Pennsylvania, and that's quite unfortunate. And this is my information. If anyone would like to reach out, I would love to talk to you more about this. And I want to thank you for listening to my story and the story of Western Pennsylvania. And I hope we can make changes, and I hope we can get the governor to come to a realization that this is unacceptable. Thank you, Laura.
Thank you. Let's see. All right. Yeah, thank you so much, Jody, and thank you everyone for presenting. Thank everyone for the work you have done. Rashida and Jody, I know that it must have been hard to share your stories, but they are very powerful and inspiring. But I know what you went through is difficult, but I believe it's just really helpful for people to hear. And it's also a reminder, as we were talking about the research and the data, that there's like real people behind these numbers. Even if we are being told that these numbers aren't significant, the people behind them are, and their experiences. And Kim and Gianna, I'm so happy to have you back here for another webinar. I feel like your expertise on this topic is just sort of like this missing piece to the conversations we've been having about the research. And I, love connecting stories from different places, from Louisiana and Pennsylvania, just in case there are any other communities out there listening, because that we can learn from each other and sort of know we're not alone in struggling with these similar experiences. There is a lot to talk about here. I'm not sure where to begin. Well, first, for the panelists who have experienced impacts living near industries, we heard a little bit from you, but how do you feel that the government, when you spoke up, that they took your concerns seriously? And the times that they did listen to you, what do you think it is that made them listen to you? And I guess, well, we can come back to that question if that's a harder one to answer. But
Laura, I could touch base on that if you would like.
yeah.
So we really pushed hard with the state in years ago, trying to reach out to anyone that would listen to us, which ultimately was the Attorney General's office. And everyone in the state was very I believe was very pleased with the results of the grand jury. I mean, that is a jury of your peers. They listened to evidence and they came up with these recommendations. So I thought that was a good starting point. But then it seemed that when it came down to it, the governor shut that down very quickly. And so, you make certain steps and then you feel like you're 2 steps behind. But that was the Attorney General's office was a good way for us to get this started.
Yeah, no,
Question.
I know. I know. Well, the Attorney General's office helped, but then when he took position as governor, it seemed to change his position a little bit, unfortunately. Well, we talked about, Jody, you talked about that CNX deal, and I don't know how much everyone is aware of the deal that sort of the governor made with CNX, but one of the agreements was that they were going to do some of their own air quality monitoring. I think it was self-reported.
Yes.
And they're all excited about this, that we're going to get more data on air quality, and this, we should all be happy that this is a good thing. And I was just curious if Gianna or Kimberly, if you had thoughts on why that could be problematic. One of my initial thoughts is that we're already seeing health impacts. I'm not totally sure what the air quality data is going to add to the information that we already have from the health impact study. But if you had anything, I know Gianna, you're just talking about how maybe monitoring isn't totally sufficient when it comes to pollution.
Yeah, I mean, in the study that I talked about that Kim and I conducted, we are using ultimately data that comes from, self-reported industry. And, just hearing Jody's firsthand experiences about, what industry is reporting, versus what, community members are actually seeing firsthand. I think that kind of speaks for itself as how, problematic things like that can be when you're leaving it in the hands of industry who, has kind of shown us time and time again that, their main goal is just, functioning as they do and making the money from it. I think ultimately, what we want is for, government agencies and the agencies that are actually making the decisions regarding, pollution and public health. I think they're the ones that need to really be held accountable as far as making sure that any monitoring being done is being done, properly, is being made available, the data to the community members who are the ones that are being, exposed to the pollution of interest. And we need to make sure that, industry is also being held accountable for the things that they are claiming to do, but aren't actually following through with. So, it's a bit difficult, because we want to say that having the monitors is good, but if they're not being, if they're not functioning the way they should, then the data is kind of meaningless almost. And if anything, the data that, industry can report, if it's not accurate and it's less than what they're actually emitting, that in a way is almost more harmful, because then you have, this data that's not accurate being referenced in decision making, which can lead to a whole nother, set of problems for community members.
Yeah, and I agree with everything Gianna just said. And I'll also share quickly, in my own neighborhood, we have a particular facility that we know is causing air quality problems. And after making a lot of noise, the state said, okay, we're going to put in an air monitoring station in your neighborhood. And we said, well, that's just a distraction, right? Like, we already know what the problem is, and now you're taking us back 2 steps. So they went ahead, they did the monitoring, they detected levels of certain pollutants above the legal limits. And then they said, well, we don't trust the instruments we used. And that was the end, right? So I think your instinct is good, Laura, right? Like, if you've already gotten to this endpoint where you have these health studies, why are we talking about quantifying exposures, right? We've already, the public health scientists from University of Pennsylvania who did the study, there's pages and pages in that study talking about how they quantified exposure. And they did it a lot of different ways. And it might not be perfect. It might not have captured exactly, every situation, like the situation that Jody talked about, that certain stage of fracking. But are the air monitors intended to address those information gaps, or are they intended as a distraction technique?
Yeah. Yeah, that's a really good point, because that's what I'm afraid, especially because it's information coming from CNX. But yeah, they're going to use it to say, look, there isn't a problem when we already have a problem. So, um, and that kind of brings me to my next question is, so I think like you talked a lot about the cancer study, but the studies overall, actually, I think the Department of Health, it surprised them in the fact that I think it showed a lot more health impacts than they were expecting to see. And also, just to put it out there, there have been lots of studies done before these Department of Health studies showing health impacts. So for those of us who've been paying attention in this region, like it wasn't a surprise, but I think it was a bit of a surprise to the Department of Health because it was something they felt like they had to publicly respond to in some way. But they haven't really made any official recommendations yet. And I guess should there be a line or cutoff to when government agencies like the Department of Health should make recommendations? What is considered enough research for governments to then say like there should be, health protective measures taken? Might be a hard question to answer, but.
Well, so I'll use an example of, I don't know if y'all remember the Zika virus, right? Several years ago, there was a lot of concern about the impacts of pregnant women being exposed to Zika virus. And there were travel restrictions or recommendations put in place, right? Like suggesting that pregnant women don't travel to certain areas because of that concern, even though the science was not definitive, right? So I don't think we need to wait to the science to be definitive to make these recommendations, right? So that's this idea of the precautionary principle in public health, right? We don't wait until we know for sure. We wait until we have reason to believe that there could be a problem, and we make recommendations based on that. If it were my community, I might try to get ahead of it. I might try to find a group, maybe a student organization at the university's School of Public Health, or maybe some of the investigators who were involved in the study, or maybe an independent group, and get them to make recommendations, right? And put that out, rather than waiting, to see what the state may or may not do. I'm also coming from a state that is very hostile towards public health initiatives. So I think you also have to, consider how likely it is that any recommendations that could come from your state would be appropriate. But either way, I think finding a qualified group of people to weigh in on that, it seems like it couldn't hurt.
Yeah, the Zika virus is a good example because you're right. We make lots of public health recommendations based on very little data, but it's usually things that are less controversial than oil and gas, which has a lot more political interests. But I guess another question I have, maybe for Jody and Rashida, is just that, we're talking about all this data, either like the air quality monitoring data and, the research looking at health impacts. And my question is sort of two parts. Has it been helpful to get this data? Does it make it harder for you, make you feel more anxious, or do you feel like it's helped validate your real life experience? Like, I guess I just want to hear from a community member perspective. Is this data felt helpful, and or has it also made things more difficult?
For me, I think it's been helpful, but it's overwhelming for me because, again, we don't have this kind of access to this data within the state of Louisiana. Everything is so, deeply embedded in industry. You go to LSU, and who is paying for that data? So it's been very helpful to get different perspectives and different data. But again, for a person who is dealing with it on a personal level, just seeing the number of people impacted, like I know it's real, I know it's happening, but seeing those numbers makes you want to not stop. Like, it's one of the reasons you go to work sick. You don't take off, you don't take vacations, because you know that this data is out there. You know that it's real. You know that the system is rigged. Like they were saying about the air monitors, we get the air monitors, then they don't use the data from the air monitors. Or, you know, we fight really hard in the state of Louisiana, then we have this racist judge who says, well, the EPA can't have, you know, so it's just like, it's always something that's pushing against you, but knowing that these facts exist, knowing that what we're fighting against is real and true and happening, it makes you want to fight harder.
No, that's good to hear. I mean, because I'm always on the end talking a lot about the research, and I find that it's helpful in terms of getting maybe government or policymakers to pay attention. But I always am a little bit nervous that like we're presenting this research and it just feels like overwhelming for people who are living the experiences.
And I want to also recognize what Chris put in the chat, that it's, you know, the data can validate people's experiences. And I always try to frame it as science is catching up to what community members have been saying all along.
Yeah. It's also got to be very frustrating to have been saying this for a long time and then find, the Department of Health study, what was so frustrating about it is, it was showing impacts that people are like, yeah, we know. We've been like living this for a long time. Thanks for thanks for finally acknowledging it.
And I just want to add, in a lot of cases, like Kim said, we're just trying to use the science to validate stuff that, has already been said. People already know. Unfortunately, most of the government agencies don't, take firsthand experiences seriously unless there's the data to back it up, which is ridiculous in itself. But, I think a major point we try to make is that, if there are, nationwide studies that already have concluded that, exposure to certain pollutants have XYZ, health effects, then, those studies should be applicable to, smaller communities. If, like, for example, we know cigarettes can cause cancer. We don't need a study in every single neighborhood in the US to also determine that cigarettes can cause cancer there. If we know that something is a carcinogen from a nationwide study, then obviously people being exposed to it in, a single community, like they're still going to be experiencing the health effects associated with that. So to a degree, it is a bit frustrating to know that, that the agencies don't consider these nationwide studies often and want those specific things that just kind of, take more time than necessary to really, put action into place.
Yeah, that's a really good point. And through my job, I've worked with a lot of researchers and scientists, and I've just found that they're very hesitant to make any like definitive statement on anything unless they can have this like absolute direct line in the research. And I think that is it's like a safety net or how their brains are wired maybe, but it's maybe unfair to say. You all were talking a lot about focusing on the risk and not the actual numbers, because by the time you get to the numbers, you already have too many people sick, I think. And if you can focus on risk and the existing science, that can help get to that. There also, go ahead.
Well, Laura, there's a question in the chat about purple air monitors that I do want to address, but if you have something else.
No,
Okay.
let's get to that. Mm-hmm.
Yeah, so Tammy in the chat asked about kind of the value of combining qualitative and quantitative data. So another way to say that is firsthand experiences and, numbers. And in general, I absolutely think that it can be really powerful. With regard to the purple air monitors specifically, I would actually say that those are more qualitative than anything else. We have spent a lot of time focused on community-based air monitoring. And the one lesson that I've really learned is that you get what you pay for, right? If $100 air monitor was reliable, EPA wouldn't be using $20,000 air monitors. So those kind of cheapo, low-cost purple air and other types of monitors can be good to tell you if pollution is higher in one area than the other. or if there's certain times of day where it's higher. Or, you know, for example, like the example that Jody gave, right? Like, is a company doing what they say they're doing at the times they're doing it, right? If I can show that, hey, pollution spiked on a Sunday and they say that they don't operate on Sundays, that can be useful. But in terms of what is the amount of pollution and is it above a health-based threshold, those low-cost monitors really don't answer that question.
I mean, what would you say if a monitor said, like, maybe there is a spike, but it's not above a health-based threshold, but there are still people having health impacts? Because that with the CNX data is something I think that will come up with them saying, well, we're not seeing, you know, it above a health threshold, but yet we're still seeing health impacts. So how do we sort of, I mean, is there any kind of response to that?
Yeah, so first I would look to see like what type of monitor did they use? Is it EPA certified, right? Does EPA consider it reliable? Where did they put it? Did they put it, you know, upwind or downwind of the pollution source? How many locations are they measuring pollution at, right? If we're talking, I mean, just the video that Jody showed was so powerful because you can sort of see how things start as a plume and sort of disperse. And you can imagine just based on wherever you put this monitor, you could get vastly different results, right? Does it, you know, and what threshold are we talking about? Are we talking about Louisiana's legal limit, Pennsylvania's legal limit, or what the World Health Organization recommends, right? Because the latter is going to be more protective. And are we considering the combined exposure to all the different pollutants? Because chances are whatever they're monitoring for is one thing, right? So the vast majority of air monitoring focuses on one pollutant at a time, right? Because the technology is designed specific to a single pollutant. So it could be measuring benzene, but it's not measuring butadiene. And the two chemicals are pretty similar and cause similar health issues. So there's a lot of detail. And I think, you know, your gut is right. When the company is in charge of the monitoring, chances are that the data are not going to be helpful to the community.
Yeah, I think cumulative impacts is an area that's like very under examined because I think it's hard to measure that, but something that definitely needs to be taken into account. Another question I wanted to bring up, and I think it's a theme I've sort of seen by what you all have said and other people I've worked with, is that there just seems to be like, you know, Gianna, you were saying that like the cancer rates in Louisiana are just high to begin with. So that maybe in Cancer Alley, it doesn't look as high because it's already really high in the state. But there seems to just be a general acceptance by government agencies that like things like cancer and asthma will exist. And so we're just going to accept it as normal and that there's just going to be health disparities and that's fine. So it's interesting to me that they would say, oh, well, Louisiana cancer rates are really high. So it's okay that these are also really, really high and not actually look into that. Have you all noticed that?
Yeah, definitely. You know, we like to say the Louisiana standard is not a gold standard, you know, just because the local rates in an area are similar to that, like that's not a good thing. We have one of the highest state rates in the US. You know, this is an issue that goes a lot deeper and you know, even hearing, you know, Rochetta talk about you know, the communities outside of Cancer Alley. I think that's another important point that we usually try to emphasize when we're presenting, but we were a little crunched for time. But, you know, people like to focus on Cancer Alley specifically when talking about, you know, these types of issues in Louisiana. But they like the industrialization in Louisiana is all over the state. You know, and when we're dealing with, you know, cases where the Louisiana Tumor Registry was publishing those parish values and comparing, you know, just that area of Cancer Alley to the rest of the state and completely leaving out all of the other communities in Louisiana that are also experiencing this, you know, high level of industrialization. You know, it's one, a flawed approach that, you know, we kind of got into already, but you are also, you know, excluding a large population of people who are also being exposed to these issues. You know, for example, the company Sasol that Rochetta mentioned, it is a giant plant. There's actually a picture that we usually show in our presentation to show the scale of these plants that are being located and literally next to people's homes. And you know, when you're dealing with this type of data and talking about, you know, well, smoking can cause cancer, so you're just going to have those cancer rates regardless. It's definitely difficult. And you know, Kim and I kind of ran into this during our cancer study, is that it's hard to attribute you know, specific cancer cases to the source that it came from, because there are multiple different things that can, you know, cause cancer and contribute to it. But if you're noticing an excess of cases in an area that are all being exposed to, you know, these known carcinogens and known, you know, pollutants that have these types of effects, I think that's something that, you know, really needs to be the focus point, you know, not the fact that we already have cancer, so it's no big deal. Like I said, Louisiana is not something you want to be compared to as far as the cancer rate. So, you know, it's tough.
And I just dropped in the chat, someone had asked a question about whether that court decision could be challenged. I don't know if anyone in this group has reached out to University of Pittsburgh Environmental Law Clinic. There's also a legal advocacy group in Philadelphia. So I put in contact information for those organizations in the chat, and they may be a resource.
Thank you. Yeah, I have not worked much on that legal end of it, but it's definitely an angle worth taking. Gianna, to like what you were saying though, when we were looking at the University of Pittsburgh study, you know, they were talking about their controls, and Jody, maybe you know this statistic better, but isn't in the region that they were looking at, I don't think there's anyone who lives less than or more than 5 miles from an oil and gas well. Is that right? Or do you know what that
Yeah,
statistic?
I believe that is correct.
So we were I remember we tried, when they presented this information, we tried to ask them like, well, where are you getting your controls from? Because, you know, everybody lives so close to.
Right, right. I don't believe there's anyone in Washington County. And another thing I wanted to bring up, I believe that the information they got was only from UPMC. Isn't that correct, Laura?
That's right. That's
Yes, and so they didn't, we have several hospitals in the region. We have Allegheny, we have, I even think, WVU is here as well, and none of the information was taken from those two hospitals. It was only UPMC.
and Washington Health System and St. Clair. I mean, there's
Right,
so
yeah.
they you know, it was probably just for ease of their study, but they took the biggest. But another point to make is that they didn't include all the numbers of the Ewing sarcoma cases, because they're and again, Jody may know this information better than I do, but there were family members who were like diagnosed after they started the study, and then people who had moved away, I think. I don't know, but there was definitely a handful of people more that they didn't include, and I don't know how much that would have changed the results. But there was a handful more people. Jody, do you know how many more?
I don't know how many, Laura, off the top of my head, but I know there were people that were here and then had moved out of the state and had moved from one community to another community, and everything kind of got lost in those moves. So there were definitely people that were not in this study that had Ewing sarcoma. And again, it was just based off of the oil and gas well versus other sources of major emissions that are really technically unpermitted. So no one even knows that they're blowing off at these sites. So those were two small issues that we found.
But, you know, even with all that, there still was, I think, significant health impacts shown. Even if they were like, there's no connection between Ewing sarcoma, I almost feel like that is irrelevant compared to, you know, the lymphoma and the asthma rates.
Right.
And I think that's the challenge you all face, right? Is that you have a pretty good study that shows very compelling evidence of health impacts. And so trying to thread that line between not undermining the study and not dismissing those powerful findings, but saying this is good, and now these are the areas that we need to build on, and these are the pieces that the study couldn't really fully address, right? The Ewing sarcoma, the unpermitted activities, the fact that they use distance as a measure of exposure kind of helps, right? Because they're not relying on emissions data. But not every site is blowing off the same amount of methane, right, as that one site. So, and at least for the cancer study is what I'm kind of focused on. But yeah, absolutely. Like there's big pieces that could be investigated further.
It was helpful to hear you say that it was a better study than you thought you could have gotten in Louisiana. I mean, we worked hard for it. Jody worked hard for it, and waited many years for it to come out. So that was, was helpful. But we don't have a whole lot of time left, but I would be interested to hear from both Jody and Rashida if they had, like, give them a chance to say what their specific asks would be, like, if, from their government, like what they want to see redone, based on, their experiences living in these communities.
My specific ask is that all 8 of the 43rd statewide grand jury recommendations are implemented. That is from a jury of our peers, and it needs to be implemented. The state government needs to take action on that immediately. And the governor absolutely has to disengage with his mutual interest collaboration with a criminal company that has harmed his citizens in the state of Pennsylvania.
And my ask would be that this administration halts all new permits for new fossil fuel extractive industries and really take a look at the public interest determination. And that includes involving frontline community members in those determinations, looking at the health impacts, looking at cumulative impacts, which we know is what the EPA has started to announce that they'll be doing. It's great that the EPA is, cutting emissions on methane and making all of these rulings, but that's just the first step. Because again, for states like Louisiana, when we're granted primacy, like recently we were granted primacy over Class 6 wells, when you have judges who say, no, we will not cut the emissions here in the state of Louisiana, is this state works against us. So we really need the federal government to say, hold on, we're no longer going to allow these facilities to come into these communities as we evaluate what's going on, as we look at the public interest determination. That's one ask. The second ask is that we reinstate the export ban that was lifted during the Obama presidency. We really need to reinstate that ban, and that we pass the Fossil Free Finance Act so that even if these facilities get the permits that they need from our federal government, that the banks aren't able to finance them because they are financing environmental racism.
Thank you. Those are very strong asks. And I guess, like, my next question is just a little bit about how can, like, people who are doing the research or people who are helping, like, disseminate the research, how can we, like, help support you all? And then, yeah, how could we see us, like, people doing the research and scientists, work together with community activists? And anybody can answer that.
I think for me, I think my answer is always going to be use the platforms that we have available. Right now, there is so much information out there on social media. Frontline activists all across the world are sharing information. If we can make collab videos with experts, with scientists, with people who have the data to back up the photos and the videos. If I am in my community and I'm making a video of the flares that are happening, if you go down through the comment section, there are so many people on there that are saying, what is that flare? What is methane? What is it doing? What does it do to communities? If we have those scientists and folks with this data on those videos who are connected directly to especially our young people, to people who will be voting for the first time in this election, I think that will be monumental, because right now we are at a precipice, right? When we look at what happened with COP28, with the language that is in the GST saying that we must phase down fossil fuels. This is our moment. This is our moment to really push this data, really push the facts, and engage in a way that we haven't done before. And I really think that it's through social media and through the platforms that are available to us.
Yeah, thank you. Does anyone else have any thoughts or input on how we can work together more? I know there are some questions here in the Q&A, talking about the DEP. And I don't know if I can answer these fully for Pennsylvania, but I do know that there is a problem here with the DEP and DOH not communicating fully and very much thinking that they work in like silos instead of seeing their work as overlapping, which there are some states that they're actually in the same office, the DEP and DOH, but not in Pennsylvania. And that I think would help with some of those issues we see there. One other thing I wanted to ask real quick, if we have time, is just looking at, we're talking about cancer rates, which obviously cancer is a big issue, but it takes a while to develop. And if there's been any discussion about the fact that if we're waiting for, 10, 15 years for cancer to develop, what health impacts are happening in the meantime, because cancer is definitely one of the scariest ones, but asthma is a pretty scary disease too. It's just because it's more common. It's maybe not, I don't know, it's not been carried the same weight in some of the conversations, but didn't know if anyone had thoughts on that, or Jody, if you had something to say about the previous question too.
I did, and I'm sorry, I don't want to
That's
hit the subject back, but I will say we just had another incident about a week ago at this same picking station. And I did file a complaint with the DEP. I think there's been sweeping changes at our DEP. And on the complaint form, there was a button for me to push that said, if you felt that you were having health impacts from this incident, and you were able to click on it, and it's asked if you wanted someone from the Department of Health to contact you. So I think that is a little bit of progress. And that's something, again, that we worked very, very hard on, trying to get the DOH to come on tours in our area so they could talk to residents and they can see that these complaints, they need to be aware when something happens that there could be a medical issue. I mean, it's so I think that's a step in the right direction. And I wanted to point that out.
Yeah, I think it's important to point out the wins we have gotten to, Jody, because I know, and at least in Pennsylvania, I've been working really hard on a lot of these issues, and it feels like we've just like inched forward, but there have been changes made. So that is, does anyone have any final thoughts or things they want to bring up?
I want to say again, congratulations to all of you on getting these studies done. Like this was a lot of work, a lot of money that went into this. And I know it wasn't something that the university or the Department of Health undertook lightly or would have done on their own. Like there is no question in my mind that they would have never done this on their own. So I hope you all, celebrate that success as you continue to fight the challenges.
I also would like to add, I saw they dropped our Kim and I's emails in the chat. Anyone who's interested in finding more out about our studies, or, just how they can weigh in when it comes to a lot of the public comment periods for a lot of these permitting decisions. I know there's probably a pretty large Pennsylvania base in the attendance, but if anyone's interested in weighing in on some of the things happening in Louisiana, I think the more people, the better, especially, if it's anyone who, is a physician or can offer that perspective. And I think, often we are lacking in Louisiana as far as, people who choose to weigh in public comment periods. So, yeah, if anyone's interested, please reach out.
Well, I honestly feel like I would love to like talk with you all more about all these issues, because you all have like so much like knowledge and experience to bring to this. So thank you for sharing it with us. Sort of my final thought for the day was just to say that I think we can't keep allowing people to become numbers in a study, which when there's real life, health impacts happening. And because I often hear that we need more data or we need more research. And what I hear when people say that is they're saying we need to let more people get sick. And so, yeah, I just want to continue for us to move forward, knowing that there is a lot of data and research and science out there already that we can trust to hopefully help make changes and get health protective action. So thank you all, and hope we get to chat again sometime.
Thank you.
Thanks, everybody. Have a good day.
Thanks, everybody.